Good afternoon, one and all, and welcome to our first ever webinar under this context, the implications of COVID-19 on Trinidad and Tobago citizens and the economy. My name is Michael Gray, and I'll be your moderator for this hour-long session. We'd like to thank you, whether you're at work, whether you're at home, whether you're quarantined, or whether you are just interested in thinking ahead on how we navigate through this crisis on a science-based, evidence-based basis, and what thoughts we can take to project into the future. The future is obviously an open book right now, but with the benefit of our panelists, history that has gone by, and some educated guesses, we can project into some likely scenarios or likely key factors that we should consider going forward. This webinar is hosted by the Center for Strategy and Competitiveness at the Arthur Lockjack Global School of Business, and was established in 2012 with the aim of becoming the leading competitive institute in Latin America and the Caribbean. The center's philosophy involves a holistic approach towards competitiveness that is focused at both the micro and macroeconomic levels. The efforts of the center are geared towards improving competitiveness of organizations and economies. This is done through the provision of customized strategic business services, training and consultancy, services that are designed to inform policy formulation and implementation at the national and regional levels. We will now introduce our distinguished panelists to you. We have Dr. James Hospitalis, who is the former executive director of CARPHA, the Caribbean Public Health Agency, which is very much in the news these days, a 23-country organization dedicated to preventing disease, promoting, and protecting health. He is the chair of the Defeat NCD Partnership, a public-private sector partnership that aims to address non-communicable diseases, NCDs, in low-resource countries. He's a co-chair expert panel on climate change and health in the Caribbean. He's also the adjunct clinical professor at Tulane University School of Public Health. Dr. Hospitalis has over 30 years of experience in global public health and responding to public health emergencies of infectious, natural disaster, or man-made origin. He served as the inaugural executive director of CARPHA between 2013 and 2019, catalyzing new partnerships in tourism and health, and leading the agency to become a recognized player in the global public health field. He raised attention to climate change as the #1 threat facing the region, and the other side of the same coin as NCDs in small island and low-lying developing states. He was the coordinator of chronic disease prevention and control at the Pan American Health Organization from 2007 to 2012, and from 1998 to 2006, he was the director of the Caribbean Epidemiology Center, CAREC. We have Ms. Vashti Gayadeen. She is the Chief Executive Officer of the Trinidad and Tobago Coalition of Services Industries. Vashti has more than 20 years experience in research and development, policy design, SME development, global and institutional competitiveness, and international relations. She is currently a member of the National Quality Council of Trinidad and Tobago. Prior to joining the T&T CSI, Vashti worked in academia, public and private sector, including the Arthur Lockjack Global School of Business, the Trinidad and Tobago Chamber of Industry and Commerce, Economic Development Board, the Trinidad and Tobago International Financial Center, and the Ministries of Energy and Public Administration. She spearheaded several projects with international development agencies such as the Inter-American Development Bank, UN ECLAC, and the World Bank, and has a proven track record in developing research products that enable the business community to make well-informed decisions. Vashti holds a first degree in history, a master's in international relations history, and a postgraduate diploma in the promotion of financial markets. She recently has obtained a certificate in cluster development of the Economic Foundation for Cluster Excellence and Competitiveness Company. Vashti has been charged with the responsibility of repositioning and rebranding the T&T CSI into a research-driven entity. Dr. Kevin Michael Fleary holds a PhD in Management Science and Engineering with a focus on industrial engineering. He is a member of the faculty at the Arthur Lockjack Global School of Business, responsible for leading the areas of operations management, business analytics, entrepreneurship, and innovation. His research and consultancy interests focus on the application of data analytics for inventory and supply chain management, as well as behavioral operations management. He brings a wealth of experience and knowledge to the team. Dr. Richard Ramsawak is the head of the Center of Strategy and Competitiveness at the Arthur Lockjack Global School of Business. He has significant experience in coordinating the development and implementation of national level strategic plans and competitiveness initiatives domestically and internationally. He has participated as a facilitator for the Inter-American Development Bank, sponsored Caribbean Growth Forum, and acted as lead consultant for the competitiveness analysis of the Southwest and 4C growth pools of Trinidad and Tobago, a project commissioned by the Economic Development Board of the Ministry of Planning and Development. Dr. Ramsawak is a Fulbright scholar and completed his PhD in economics at Clark University, Worcester, Massachusetts, in the USA. He holds an Executive Master of Business Administration as well as a Master of Sciences in Economics from the University of the West Indies. He has also completed various specialized private development programs in areas such as export diversification, sustainable enterprise development, and cluster development offered by the World Bank, the ITC/ILO Summer Academy of Enterprise Development, UNIDO, and the Harvard Business School. He has contributed at expert meetings at the United Nations and at international business and trade promotions events. Dr. Ramsawak is an affiliate member of the Microeconomics of Competitiveness Network of the Institute of Competitiveness, Harvard Business School, the American Economic Association, and past member of the Competitiveness Institute, as well as past secretary of the Trinidad and Tobago Economics Association. Ladies and gentlemen, this is your panel for today, and we now turn to Dr. James Hospitalis.
Thank you very much, Chair. In the next 7 minutes, I'm going to set the context for this pandemic that is the subject of the seminar for today. Do I change the slides? Next. Thanks. Well, this slide is pretty data dense, but it covers the basics. Sorry, this is the overview of the whole talk. The basics and the situation we face, some scenarios, look a little bit at lessons learned and the bigger context that we face, and then conclude. Next. So going quickly, most people should by now be familiar. We have a new emerging infectious disease that causes a respiratory illness in the world. Sometimes it's severe, causing pneumonia and death. It is diagnosed by a lab test. It began in Wuhan, China in late 2019 and spread, as you know, nationally and then globally. The initial reservoir was likely wild meat sold at a wild animal market in Wuhan. And that touches on the fact that we humans keep encroaching on forest and the environment, and sometimes these viruses emerge to cause these problems. Globally, we're approaching 1 million confirmed cases and 40,000 deaths. We've seen steep exponential rises, US, Italy, Spain, the UK. I have a lot of friends in the UK, and that's a great concern. There's been slower spread in some countries, and therefore lessons to be learned on what have they done: Korea, Japan, Singapore, Taiwan. Trinidad and Tobago coming home. I believe we have 85 cases and 3 deaths to date, with no evidence of community transmission yet. The spread, as everyone should know, is by coughing, sneezing, shaking hands. Incubation period 2 to 14 days. And communicability is believed to be maximum during the symptomatic phase, but it can start before. Prevention and yeah, I think the study in Trinidad of the cruise ship that is in this second to last bullet here is interesting. 49 out of 71 persons, or 7 out of every 10 coming back from that cruise, were infected. All ages are susceptible, but the elderly and those with pre-existing conditions are more vulnerable to severe disease and death. Next. So prevention and control, well, this is not a medical audience, so I'm not going into great detail here, but here are the kind of highlights that everybody's talking about, has to be reported and traced: isolation, disinfection, and supermarkets all sold out of this stuff. quarantining people, protecting and isolating contacts, investigating, tracing. That's a big workload, the tracing involved. If you think of how many contacts you've had in the last 10 days, it's very difficult to figure it out. There's treatment in terms of some supportive treatment and the emergence of evidence on some specific things like antivirals that maybe antimalarials that maybe make a difference. Public information, regulations. This country has promulgated a number of regulations, and the stay-at-home situation we're now in. Very importantly, in any country is the preparation of the hospital and health services and how you're going to cover people who have difficulty with access. I would say Trinidad and Tobago is in the brace phase because we have no early spread yet, and we're certainly not yet in a widespread epidemic phase. But there are lessons from many others. Next. This slide is just the last pictorial slide. It's early days yet with COVID. Why do I say that? Well, to the right, you can see the evidence of SARS, which hit us in the early 2000s, another coronavirus, and approached 10,000 cases globally, and you see the impact there. But COVID is now really taking off. Perhaps China has really contained it, but the rest of the world, this is a logarithmic scale on the left. So we really are in the steep exponential part of it, and it's hard to predict exactly what will happen. If you could just go back up to my cover slide on the content of this talk, please. So what are some of this next one? What are some of the scenarios? Well, we may see a situation where in Trinidad and Tobago, if they haven't got these kinds of measures in place and it came in, you might have eventually 60% of the population, 80% getting it, and 1% dying. That's about 12,000 people overall in broad brush terms, and that would triple the annual mortality rate. We lose about 6,000 or 7,000 people per year. So, and then eventually you will have the majority of people being immune, and the disease would enter the background circulating diseases that sometimes cause respiratory problems. And the likelihood of entering is high, and the risk for certain people and for certain small businesses, for example, could be pretty catastrophic. So mitigation measures really are necessary, and we'll be talking about that next. A few words on the planetary health context. As climate changes and we keep deforesting, we keep turning up these new viruses for us to pay attention to. The growth in travel and tourism, and therefore how infectious diseases can spread around the world. Demography, where we have an older population that's more susceptible, and in the previous flu epidemics, that's not been the case. Non-communicable diseases, problems with health systems, access. If you look at the United States, perhaps 100 million people, either poor, underinsured, having difficulty in accessing it. And I think this is going to cause a relook at the WHO international health regulations. So in conclusion, this virus is changing the way we live, learn, work, play, and pray, as we're seeing right here in Trinidad. It is an unprecedented threat, but there's quite a lot of opportunity to work in new ways and for new kinds of partnerships, which requires a lot more joined up data and partnerships which take people, government, private sector, and the planet into account. Thank you.
Should I go ahead?
Thank you, Dr. Hospitalis. We now have Ms. Vashti Gayadeen, the CEO of the Trinidad and Tobago Coalition of Service Industries.
Thank you, Michael. Good afternoon, ladies and gentlemen. Without a doubt, COVID-19 will have a significant impact on not just the global economy, but the national economy. My focus, next slide, my focus is on its impact on the services economy. The services economy in Trinidad and Tobago accounted for roughly 53% of GDP over the period 2011 to 2018. I am now going to, next slide, I'm now going to focus on the state of play, and I'm going to paint a picture for you of what is happening on the ground. This is based on survey results from our members. Prior to March 12, 2020, that is when our first COVID-19 case was reported, The business community was grappling with a number of bureaucracies that was making it much more difficult to do business. This included difficulty in clearing shipments, delays in securing passports and work permits. The TTCSI is an association of associations, meaning we represent all major services associations in the country. We have roughly 53 financial and non-financial members, ranging from business and professional services to creative and cultural industries to midwives and bankers association. As you can tell, it's a very diverse membership. Bear in mind also that with the falling oil and gas prices, the services sector is seen as the engine room. These are the sectors that you saw on your screen, that you are seeing on your screen now. These are the sectors that can accelerate growth of the economy and, more importantly, lead the diversification of the economy. So what are the findings from this survey? Next slide, please. Without a doubt, one of the sectors that has been hit hard is the tourism industry. In the case of Trinidad, TTCSI, in collaboration with several stakeholders, including Tourism Trinidad Limited, developed a robust cluster plan for MICE tourism. MICE tourism simply relates to meetings, incentives, conventions, events. This is a niche market that we have a comparative advantage. The global pandemic and the impact on the events industry is unprecedented. The year started off strong across the board. And CAPEM, which is the local event managers planners association, they noted that they are now seeing a material impact on their businesses. While the ultimate magnitude of this near-term impact is unclear this time, the forecast right now is very bleak, not only for event managers, but for the complete value chain or the service industry throughout the supply chain. Just to give you an idea of the magnitude of this impact, there are roughly 222 registered event planning firms in the country. Out of those 222, 65 operate in Northwest Trinidad. Out of those 65, 42 export their services. And this is out of those 222 firms, their average income is roughly 2 million. This sector contributes 7% to GDP. These firms are labor intensive. All events, thus far all major events have been canceled, incurring losses for all of these firms. In terms of advertising, the advertising industry stated that their industry has been decimated. Barbers, cosmetologists have all been negatively impacted. All of these firms are currently facing cash flow problems. They are all in survival mode. Next slide. This really is a geographic, is a geographic of the 65 firms that I spoke about before. Next slide, please. I will, during the question and answer, I will refer to this slide. Next slide. So let's look at some of the opportunities. One of the industries that has had there has been some silver lining is without a doubt the animation industry. The industry overall has been managing due to the digital nature of the business as much of its work has been able to continue remotely. Some businesses have experienced more positives, including increase on new contracts, easier access to payments that have been forced to become digital, increase access to software and training online. However, and again, based on the survey results, 40% of firms in this industry have been negatively impacted. 50% are managing business as usual, and 10% are onshore. Chasing international contracts for foreign revenue is the priority for the sector right now. There's a lot of opportunity currently, especially due to many service providers around the world who are out of commission. In closing, I'd like to emphasize 3 points. We are navigating an uncharted waters. There are businesses that, without a doubt, will fall, but the majority of firms will ride the wave and will survive. Secondly, the silver lining is that more firms have transitioned overnight to a digital platform. So local internet service providers need to ensure that their supply is reliable and consistent. Some of these firms are already exploring collaboration with regional and global players. And finally, and most importantly, I think what this has taught us that the foundation block of a strong economy is a healthy workforce.
Thank you so much, Vashti. We now turn over to Dr. Kevin Fleury, who will be speaking on the supply chain implications of the coronavirus. Dr. Fleury.
Good afternoon, Michael, and thank you, and good afternoon to all the attendees. Next slide, please. Now, there's a lot of talk about the supply chain, but I want to take a minute and evaluate what exactly is the supply chain. The supply chain has a supply side and a demand side, and the supply chain really refers to all the activities involved in communicating information, products, and services from the supply side to the demand side. What does that mean? That means that the supply chain actually is relevant to a lot of industries outside of the manufacturing industry. If you would look to your right-hand side of your screen, what you would see are tourism and hospitality, aviation, oil and gas, automotive, consumer products. All of these industries will be adversely affected by the COVID-19 that we are currently experiencing. What I would like to highlight here on this slide is the sectors that are predominantly heavy when it comes to human interaction: tourism, hospitality, aviation. These industries will take the longest to rebound from the COVID-19 experience. This diagram here adapted from McKinsey, from a McKinsey report that was released earlier last week, indicated that globally, the anticipation is these industries can take at least up to Q4 and Q3 to rebound, which is later in the year, right? So global supply chains rely on an efficient production, logistics, and distribution cycle of time replenished stock, enabling demand side cost savings, which means volatility along the supply chain will cause price increases and uncertainty. And this uncertainty can further do what? It can further make demand contract, and therefore the balance between the supply side dynamics and demand side dynamics, because of uncertainty, we can experience a lot of cost inefficiencies, delays, and this can have adverse effects on how we consume. Next slide, please. So let's take a closer look at the supply side considerations. And if you guys have any questions, feel free to type your questions within the Q&A area, in the chat area of the presentation. So supply side considerations. The coronavirus is acting as a catalyst to global supply chain. Prior to the coronavirus, FDI seemed to be moving out of China. to countries with low labor costs. Currently, our predominant supplier is the United States of America. However, we still predominantly do a lot of trading with China. Countries have realized the vulnerability of the supply chain, given a centralized approach to import-export, and they are moving out of China. Countries are questioning the centralized approach to One China, One Belt Road initiative on grounds of democracy, the national security agenda, timely access to necessities, employment, right? What is actually happening, if we were to use an example, given the coronavirus, a lot of companies within China have decided to move away from their production lines to go into the production lines of N95 face masks, for example. What does this mean? The burning question now is, if we were to purchase this particular N95 mask, how can we verify its quality standard? Because we are in a time of uncertainty, what you would find is increased demand for certain items, and therefore supply, given the balance between supply and demand, supply will chase that demand. At this time, we are not guaranteed on the standards of production, and therefore how are we, and this is going to last not just during the coronavirus, but after the coronavirus. How are we going to manage our supply chain? Well, the only tool that we have at our disposal as far as supply chain management is concerned is something called supply chain visibility, which is generally increasing the information or the knowledge about your suppliers at different tiers in the supply chain. Where are their goods coming from? Who are the suppliers of your suppliers? And we need to have visibility along the supply chain to make better and informed decisions to protect the citizens that consume our goods and services. Next slide, please. So demand side considerations. Demand patterns are being influenced by the coronavirus because ideally the demand patterns to a large extent are contracting. Why? Because of job loss, because companies are not able to maintain a positive cash flow at this time. So what is happening is people, you would start to see people's demand patterns are changing, and this can have a contraction on consumption and the economy as a whole. Increase in health awareness is causing changes to demand environment. The demand environment is thriving, however, in e-commerce, which tells us we ought to take heed of this. The question is such a situation unique, and is it going to reoccur? If the answer is yes, then we need to put measures in place to take advantage and do not contract as an economy given these type of situations. I'm going to move to in the chaos, point 6, in the chaos, we need to find the middle ground as changes occur. We can expect to experience inefficiencies, increased costs until the integration is optimized. One way to understand what customers really want in this uncertain time is via customer analytics. Next slide, please. So implications on the supply side in Trinidad and Tobago, given that corona in the short term, given that the virus stays on metal surfaces for 12 hours, fabric 6 to 12 hours, we need to ensure that our monitoring and evaluation increases at this time. Another short-term measure, we need to manage supply chain risks, renegotiate for advantages both on demand and supply side, re-examine business models for diversification of supply chain networks, seek ways to first stabilize, then grow regional supply chain, which is highly dependent on speed, reliability, and cost savings. So any bottlenecks in our system as far as the supply chain is concerned, in the port, for example, we need to find ways to ensure that we have speed, reliability, and cost savings. Short-term to medium-term measure, increase supply chain visibility, Businesses must manage suppliers that operate at varying levels of the supply chain network, as we can no longer depend on traditional information flows. Short-term to medium-term measure, business support, both private and public. We need to transform the way we do business because this is an enabler for supply chain visibility. Next slide, please. Implications for Trinidad and Tobago demand side. What we are seeing because of the uncertainties and the coronavirus is demand patterns are changing, not just in Trinidad and Tobago, but the world, right? And they are changing in support of the use of technology. So therefore, systems that support consumption and buying patterns with the use of technology, for example, digital financial support, information and sharing of information needs to be invested in for future consumption and demand. Next slide, please. Generally, what we are seeing from the research is that companies that invest in supply side dynamics, building supply capacity within their country, they are growing significantly their gross domestic product. So failure to realize global trends and changes to demand and supply will result in both inefficient and ineffective supply chain. Given the chaos to global distribution, it is time for stakeholder planning and execution of steps to increase the national competitive advantage for regional trade. And a resilient supply chain will diversify Trinidad and Tobago gross domestic product. We therefore need to prioritize the development of supply chain ecosystem with a focus, I would say, on maritime. And thank you.
Thank you so much, Dr. Flery. Before we move on to Dr. Ramsawak, we'd like to encourage you to log your questions in the Q&A tab. There's a chat feature in the Q&A tab, and the Q&A tab could be found in your menu that should be across the top of your screen. If you just hover over there, it should drop down. So please again, record your questions that we can take after Dr. Ramsawak's contribution. Dr. Ramsawak, the floor is yours.
Firstly, thanks, Michael, and thanks to the members, the panelists, as well as the online audience. Next slide. So, I mean, my contribution would be more from a strategy and economic point of view, and I will start off by saying that COVID-19 really comes at a really inopportune time. It comes at a time when many of the Caribbean countries, including Trinidad and Tobago, really have just begun to recover from a recession as it were. And so there have been a lot of doubts in terms of Trinidad and Tobago has returned to growth, but certainly in the last budget, based on the data that we have from CSO, we have seen some positive growth. But prior to that, we saw the closure of Petrotrin. We saw layoffs in TSCT. Unemployment was on a rise. And so this is a really bad time for COVID-19 from an economic point of view for the Caribbean as a whole. Next slide. Yeah. Now, a lot of the questions that has been asked us prior to this event is, how long will social distancing measures and the global national shutdown last? Our position from the center is that the social distancing measures and the shutdown are necessary because what we have seen empirically is that the countries that have actually better managed social distancing and more hygiene methods actually have had lower rates of growth. And the idea is that we want to have this plateauing so that we don't have an overwhelming of infected diseases relative to available hospital beds and doctors. And again, the countries that have been kind of slow to respond in terms of taking the rates of growth of infection seriously are the ones who have actually had these really high levels of economic growth. The second thing is that in terms of how long, and so the Imperial College of London, which is the organization that actually has generated a lot of the models in terms of predicting the growth in COVID-19, and which a lot of the governments base their social distancing policies on, actually predicts two kind of bimodal influxes of growth. One now, and then eventually if these measures are taking place, we see a slowdown in growth. But then when measures are relaxed, they see a next boost in the levels of infections. So in our prediction, at least 1 quarter, which we estimate about 3 months, and at worst 6 months. But definitely we need, from the long-term perspective, to see COVID-19 as a new norm in terms of how we do business. Next slide. So what are the options for recovery? What would the economy look like post-COVID-19? It's difficult to say, but definitely based from information from the Macroeconomic Center from Harvard Business School, there are three basic options. One is a V-shaped recovery, which is what Canada experienced post-Great Recession, which is the economic growth kind of rebounding to the level prior to the economic shock. So that's a nice V curve. The other option is a U-shaped curve, which is there's a rebound, but the growth levels are nowhere close to prior to the economic shock. So it's a U-shaped curve. And a worst case scenario is a L-shaped curve, which is economic growth really taking a hit after the infection, after the economic shock, and really bottoming out. Now, what determines which shape is really the impact, as all the panelists have said, is on the supply side. In other words, if during this period of shutdown, we see not businesses closing, but actually going into bankruptcy, if on the productive side, these businesses close, then what you would find is even after the economy reopens, the supply side will be negatively affected. The other thing to consider is the monetary side of the equation. In other words, as businesses close, as people become unemployed, loans go into default. And so now the financial system, as it were, could be compromised. And again, that's where the role of government and definitely the central bank comes in to make sure that the financial system is bolstered and the required input in terms of capital expenditures is kind of given to re-stimulate the economy. Next slide. The other question that we had is in terms of which sectors will be affected. And it's difficult to say because each company is different in terms of the quality of management that they have and the resources that they have access to. But one of the leading indicators for companies' sectoral performance is really the stock market. And so we monitor the S&P 500. And definitely we've seen companies in the energy sector, transportation services, which includes airlines, maritime shipping, and durable manufacturers such as automobiles taking a massive hit post-COVID-19. Not all these sectors are actually doing bad, however. So for instance, utilities, healthcare, ICT, telecom, in terms of stock prices, they are actually doing much better post-COVID-19. In terms of Trinidad and Tobago, I agree with Vashti completely. Unfortunately, a lot of the sectors in terms of employment fall into sectors in which will be directly affected by COVID-19. So community, social and personal services, which includes like barbers, health spas, those as well as restaurants and hotels, constructions, collectively, that sector employs about 68% of the total employment in Trinidad. So at least 68% of our employment will directly be affected by COVID-19. If these companies go into bankruptcy, there will be trickle-on effects into other sectors. So for instance, in terms of finance, insurance, manufacturing. So we have to be very careful in terms of how we manage this crisis, and we're going to talk about options of business in the next slide. Next slide, Mike. So what options we have for business? Firstly, this is a time for financial prudence. And I say financial prudence versus what we call a siege mentality. So we don't expect companies to have mass layoffs. I don't recommend that. What we're saying is that let's think strategically. Let's think about probably cutting down the hours, reducing the number of shifts where possible. Remember, you want to keep the employees engaged. You want to keep your customers as well, while at the same time managing your cash flow. You need to have innovation and flexibility in the way you do business. So for instance, we've seen instances where Angostura shifting their operations from the production of alcoholic beverages to the production of hand sanitizers. True Value, taking orders for groceries using WhatsApp. This is the kind of innovation that's required. From an educational point of view, Lockjack now, for instance, are offering much more online programs, shorter term. So as people are home, there's an opportunity for them to actually upgrade in terms of skill. There are some companies that we consider to be essential services, and so they have to remain open. So for those companies in particular, they need to be very careful and understand how COVID-19 affects not only their customers, but then also their employees. I've seen instances, for instance, where security companies still send their workers out without any mask or hand sanitizers, and that's something you really want to avoid. Now, government has a role in terms of ensuring health, safety, and the rule of law, But we see this as a tremendous opportunity for government to leverage the digitalization of its services. And so we have been talking about this for 10 years. And so far, in 30 days, we have seen so much progress. We have seen virtual platforms being offered in the judicial system. We are thinking about virtual platforms for facilitating visitation at hospitals. And this is where the government needs to be really innovative. As I mentioned before, there needs to be a provision of safety net for those who will be affected. So as Vashti mentioned, companies will go out of business. And so the government needs to identify who these people are and provide some kind of support to them financially. But then there's also support that's required post-recovery to really regenerate growth in the economy. And the timing of that is important. And again, at a global level, when we're talking about all these countries trying to regenerate growth, you need to talk about lending and the kind of support international institutions offer to these governments. So again, the IMF already has carded $1 trillion in support of nations with COVID-19, but they talk about lending. For some countries, lending is not an option or borrowing is not an option. So they have to think about more sustainable options. Finally, civil society. So Justin Ram, the chief economist for Caribbean Development Bank, has spoken about having a tri-party approach, and we believe that. So compliance and responsible behavior on civil society, financial prudence, and really seeking opportunities in terms of collaboration and supporting particularly marginalized. And I'll just give you one example of that from Lockjack GSB. Next slide. So this is the work that we are doing right now with the GIS Society of Trinidad and Tobago, trying to identify areas where a lot of the population is what we consider to be at risk, which is over 60 years and over. We are using actually Facebook artificial intelligence data modeling to identify which communities in Trinidad and Tobago have an advanced 60 years and over population. And then where is that relative to the health support institutions that are available? So then we could help inform government policy in terms of which areas need to be targeted for support during COVID-19 lockdown. So these are my comments. Again, I'd like to thank everybody for contributing, and we're open to questions.
Okay, first question from Elizabeth Howe. What advice would you have for the part of the population who has limited access to income and to a larger extent, the use of technology? So those persons who are limited in terms of income, but don't also have access to technology to leverage some of the new opportunities or even to weather the storm right now. Panelists.
So Michael, if you want, I could probably try and take a shot at that. Sure. I mean, this is where information is important. You know, how do we identify who these people are? So again, this is a discussion that I had with Vashti and the other panel members prior to this event. So we've heard, for instance, that the government said that they're going to eventually do a payout to persons, and I think that's particularly those who are affected in terms of unemployment. The question is, what is the mechanism to find these people, and how do people apply and actually apply for the support? So we saw, for instance, in the case of the United States, there was a 3 million increase. I think 3 million people applied for unemployment relief within a space of probably a week. And so they have a mechanism in where people could actually apply physically or otherwise to get the support. So I think communication is required. I think also these NGOs, the churches, I know we have social distancing rules and limitations, but that's where they come into play in terms of using the informal networks to find these people and provide the support, both from a government point of view, then also from an NGO point of view.
Okay, thanks, Richard. Question to Vashti. As a business service provider to SMEs and startups in areas of IT, advertising, business strategy, and retail services, what are some practical strategies we can advise for our small businesses to recover?
This is an excellent question that we have been grappling with. Definitely at this point in time, we have had to think, set up focus groups, virtual focus groups with our members. So there are associations that have not spoken to each other before. They have not, and they are now looking at avenues to collaborate. So this, again, I would stress on the collaboration, partnerships, and it's just not nationally. As you have, where I pointed out what is happening with the animators and the advertising industry. They would have to, they are not just looking at local service industries, but also regional contacts.
Okay, thank you. Another question maybe to Dr. Hospitalis. What is realistic over the next 2 to 3 months, given the crisis businesses are facing? What is your advice? Should leaders focus on navigating operational challenges, or should leaders be engaged in strategy? Planning for after the, what is the new normal? Given your knowledge of previous epidemics, maybe yourself and Dr. Ramso could speak to how has businesses or the private sector navigated emerging from previous kind of epidemics?
Thanks there, Kevin. I mean, the world has faced epidemics before of various kinds. HIV was a very slow-moving one that's not quite over, and it killed millions of people. SARS, also maybe a $50 billion hit on the economy, but this COVID is going to outclass it, I think, at the end. So this one's unprecedented in our lifetime in terms of in two generations, in terms of the sort of sweet spot of lethality and transmissibility without symptoms in many that this disease has hit. And it has met an unprepared population with, it's a wake-up call. We have how we organize our health services, access to people, which ties to the issue of income, and how the herd, the human herd, if you will. My wife's a veterinarian, so we often have these jokes. The human herd is ill-prepared. And one of the rapid things that can be done to fortify the human herd is to address some of these, what we talk about, pre-existing health conditions. Find them, get them under control, stop smoking. These are some of my key messages to people, to government, and to businesses, that if we improve rapidly on the detection and management of some of these chronic health problems, you will in fact make yourself more resilient in the face of this epidemic.
And as a follow-up to that, Dr. Hospitalis, what incentives would you suggest, or what incentives have worked elsewhere to encourage the development of a healthy workforce going forward?
Well, that's another good question, and I think everyone's more open-minded and more receptive. One of the silver linings around all of this, and beside the pain to people and to businesses, will be new ways of doing and seeing things that we haven't. New situations create opportunity for doing things that we haven't done before. Some kind of scary. Some of the big data joining up that's going on from an individual citizen freedoms point of view makes me uncomfortable. On the other hand, from a public health point of view, I go, yay, we get better control of the epidemic when we can join up national security, social security, health data, economic, personal, financial, and banking data, travel and immigration data. It gets kind of scary. Where do you stop? So that's by way of a partial answer to you there.
Okay, great. I see Dr. Fleury wanted to make a comment. Dr. Fleury.
Yes, Michael, thank you. If you could recall, on my slides, I indicated that particular industries are going to be affected more so than others. So the industries that are high in human interaction, which includes services industries, would be impacted to a greater extent, and their operations would be slower to rebound than manufacturing industries, for example. What this COVID-19 has shown us, as I would like to reiterate, is that we are ill prepared for such situations, and the way in which we work is not conducive to such pandemics. So we therefore need to work, rightfully so, as the Prime Minister said, at a reduced capacity. And we also need to ensure to take this time to plan for future events, because this is the new normal, and we cannot afford to be in the situation that we are currently in. Because if this pandemic is to continue for an extended period of time, the longer that we are in a stay at home, no work, go slow situation, is the longer we are going to have to work to try to rebound economically and to try to get the supply chain back up again. And even when it is back up, it is going to have so many uncertainties and changes that trading using that supply chain is going to be inefficient and costly.
All right, thank you. Richard and Vashti, a question on the financial services sector. This has been a touted sector of our diversification thrust, and we are relatively prepared in terms of personnel expertise and so on. What are your predictions for the insurance-based or the financial services sector coming out of the COVID-19 experience?
Michael, before we address that question, I just want to go back to the foundation block, because I spent some time thinking about this. And this is an opportunity for services firms to think about packages in terms of mental health and wellness. And there are substantial number of firms in Trinidad and Tobago, and they need to strategize and come up with some products that they can go to the business community and say, here's what, these are some services that you should incentivize for your members, for your staff.
Thanks, Vashti. And to the question of this financial services sector.
Michael, I would like to add that especially where financial service support is concerned, we need to transform the way in which we transact. And therefore, certain key and much needed services and products cannot be consumed unless we are physically there, because we don't have a transportation or delivery system to enable it, and we don't have a system of payments that is globally accepted or regionally or nationally accepted within Trinidad. So therefore, these are two platforms that we need to address: transportation and distribution, as well as the financial support. We need to have these things available to us digitally so that we do not end up in a situation where we are deprived.
So, Michael, just to add to answer the question, so I'll answer that in two ways. One with the economics hat, based on my training, and then also the strategy hat, based on much of my professional experience. So as I mentioned in my presentation, it's important that we maintain financial stability within this time. And I say financial stability both in terms of banking as well as insurance. And so depending on how this evolves, it could have a negative impact on both. But I see this as a secondary impact, not a direct impact. So the first impact would be on the real economy on the supply side. But then the way that side is handles the problem, the extent that, for instance, the defaults, then you could see a trigger on the financial side. Now, again, if that happens, if there's a run, let's say, increase in the number of defaults, if there's a run in terms of liquidity, both in terms of TT and US, then again, that's a role for the central bank in particular and the government to kind of put measures in place to support the banking sector, the insurance sector. Because if it's not managed well, and that's their job, that's essentially what they're there for. So hopefully they will be monitoring the situation through the reporting that they have and see how we are doing from a financial system. From the strategy side, I echo the comments of both Kevin and Vashti. You need to also think strategically. So the larger question was asked, how long and how do we survive? The students of history know that there was once a World War I and there was once a World War II. And we had epidemics and crises like this before, and we're still here. So the question is, how does a company change their mindset to see this as an opportunity and leverage the capabilities that they have to regenerate business growth. And so the suggestion of thinking about new options for financing, facilitating new ways to do transactions, decisions that probably should have taken probably 2 years ago or 3 years ago should be taken now. I see that COVID-19 from a technology point of view is extremely timely. It's timely because we have already saw a mass of technology-based solutions that enables online collaboration, that facilitates online payments. The question is how quickly we are to adapt and adopt the technology that we have.
Okay, thank you. I have a couple. I'm going to integrate two questions into one. Is it now time to promote the concept of social entrepreneurship? And what role do you see the role of agriculture playing in sustaining the economy and moving us beyond post-COVID-19? I think everybody could take a shot at this. Dr. Hospitalis on food security, Vashti, Richard, Kevin, and supply chains coming more locally. Let's hear from all the panelists on this one.
Social entrepreneurship, well, with my sort of public health hat on, and noting that my son, who's locked down in London, when he tried to buy some home gym equipment, couldn't find any. So there's a nice little opportunity for the supply and installation and use in home fitness equipment that is within the government rules in this country. How fast can some of the light manufacturing scale up? How fast can a foundry switch over to manufacturing some cheap weights or something like that? I don't know, I'm just kicking that out there. Can we do some, can Trinidad and Tobago lead a distributed global party? Since everybody's in lockdown, can we use this thing and do what we're good at, organizing parties globally, get 1 billion people to dance at the same time? So that's a really far out one, but get the collaboration of all the companies. Can we have a challenge for a video visitation program for hospitals and prisons so that our social distance has a conscience, and the private sector, Flow, Digicel, Lime, all collaborate with national security and health, video visitations program. So those are a couple of ideas there for social entrepreneurship. Over.
And to agriculture in the role of public health and improving public health going forward.
Well, definitely we see it is critical for us to be able to feed ourselves. And what I've seen on social media is that more and more persons they are engaging in setting up home gardens. So that is definitely, if there is another one of the positives out of all of this, is that we know the value of feeding ourselves.
Okay, we've come to the end of our time for this webinar. We'd like to thank you for your participation, for all the attendees. We can continue the conversation on social media, and for more pointed questions, we can email the Center for Strategy and Competitiveness at the school. I would like to thank Dr. James Hospitalis for his presentation and participation. Similarly to Ms. Vashti Gayadeen, the CEO of the Trinidad and Tobago Coalition of Service Industries, Dr. Kevin Fleury and Richard Ramsawak, fellow colleagues at the Arthur Lockjack Global School of Business, who speak to strategy and competitiveness and business analytics and supply chain management. Let's keep this dialogue going, and we look forward to further sessions like this going forward as we go by. The recording, the recording will be made available to all who registered. So keep checking your email and you'll be able to review the slides in the recording as well. So thank you again and have a great day. Stay safe, but also stay positive. We have emerged as a human race from epidemics before. I was reading about the Spanish flu 1918, how devastating that was. And we have emerged. So let's be strong and let's bring Trinidad and Tobago's innovation and capabilities to the forefront as we emerge on the world stage. Thanks again and enjoy the afternoon.
Thank you very much.